Hello, everyone. Hello, welcome. We're so glad you could join us today. Welcome to Health Reform Beyond the Basics. My name is Hallie Cloud, and I'm really happy to be here today. Before we begin, just a few introduction and logistical items to go through. First, Beyond the Basics is a project of the Center on Budget and Policy Priorities. It's designed to provide training and resources to facilitate enrollment in the health insurance marketplace and Medicaid. We are a nonprofit policy organization and are not a part of the U.S. Department of Health and Human Services. Beyond the Basics is aimed at healthcare assisters, advocates, state and local officials, and others who help people get and keep their health coverage. This webinar series is not intended for press purposes, and at this time, we're not able to offer any continuing education credits for participating in the trainings, so we're sorry about that. As always, after the webinar, we will circulate the slides from the presentation. We will also circulate a video recording and other resources that are mentioned during the webinar. We're going to post everything to our Beyond the Basics website at healthreformbeyondthebasics.org. And I will put a copy of the slides in the chat as soon as I'm done with the intro. So that will be in the chat for you all. At this time, all participants are muted and in listen-only mode. If you'd like to ask a question, please click on the Q&A icon at the bottom of your webinar screen and type your question into the box. We're going to be monitoring that box throughout the presentation, and we'll stop twice for Q&A. We're definitely not going to be able to answer every question, but we do have a record and we can use them as a guide for future resources and presentations. You are also welcome to email your questions individually to beyondthebasics@cbpp.org, and we can answer them that way. Next slide, please. Today's webinar, we are going to provide an overview of the marketplace special enrollment periods, including qualifying events that trigger SEPs, eligibility criteria, and the timing of coverage effective dates. Today's presenters are Claire Hyacin, Senior Policy Analyst for Health Insurance and Marketplace Policy, and Jenny Sullivan, who is the Director of Health Coverage Access here at the Center. And with that, I'm going to turn it over to Claire. Thank you.
Thanks so much, Hallie. Hi, everybody, and thank you for joining us today. So we're going to get started with the definition of an SEP. Next slide, please. Thank you. So a special enrollment period, or SEP, is a period when someone who experiences a qualifying event can enroll in or switch marketplace coverage. People can get an SEP at any time of the year during or outside the annual open enrollment period. In states that use HealthCare.gov, open enrollment lasted from November 1st through January 15th for the 2023 plan year. And now that that period is done, we're moving into a period where people need to have a special enrollment period in order to enroll in marketplace coverage. If you're in a state with a state-based marketplace, your state may have different, usually longer open enrollment periods, and may also have different rules about special enrollment periods. So always best to check with your state-based marketplace to see what those different rules or timelines may be. Next slide. There are various qualifying life events that make a person eligible for an SEP. The main one is loss of other types of health insurance, like job-based coverage or Medicaid. People also become eligible for an SEP when the size of their household changes. So if they get married, give birth, or adopt a child. An SEP is triggered if a household moves to a different place, either within the US or if they come to the US from another country. People are eligible for an SEP if they experience changes in eligibility for financial help. And then we also have some less common SEPs. So if a person experiences a plan error or an error made by an enrollment assister, navigator, agent, broker, or call center rep, they may be eligible for an SEP. SEPs are also available for survivors of domestic violence or people impacted by FEMA disasters. And this includes the FEMA disaster SEP includes the COVID-19 national emergency, which ended on April 9th, 2023. And so the SEP flexibility for people who lost coverage during the COVID-19 national emergency and missed their opportunity to enroll in marketplace coverage will end 60 days after April 10th, which is on June 9th, 2023. Finally, there are two temporary SEPs that are currently in effect. First, there's the SEP for people who lose Medicaid or CHIP coverage during the Medicaid unwinding period. And there's also an SEP for people who have household incomes below 150% of the federal poverty level, or FPL. Next slide. There are two timelines to be aware of for SEPs. The first is the timeline to apply for coverage and select a plan. So SEPs are usually available for 60 days after a qualifying event or triggering event. Some SEPs are also available for 60 days before the qualifying event, which is called advance availability. There's an important new exception to this that will begin on January 1st, 2024 in HealthCare.gov states. So after this date, people who lose Medicaid or CHIP coverage will be able to apply for coverage and select a plan up to 90 days after they lose coverage. The second thing to be aware of is when a person's coverage will begin once they have selected a plan. In HealthCare.gov states, for several SEPs, a person's coverage will start on the first day of the month after they select a new plan. However, if a person loses other coverage mid-month and selects a marketplace plan before the first day of the month in which they'll lose coverage, then their new coverage will begin on the first day of that month. This is a new policy, and it's not expected to apply to many people since most people's health insurance ends at the end of the month. But for those whose coverage ends mid-month, this policy will help them avoid a gap in coverage. Next slide. Finally, before we get into specific examples of SEPs, I wanted to go over the requirement of prior coverage. For some SEPs, a person must both experience a qualifying event and have had minimum essential coverage for at least 1 day during the prior 60 days. And we'll note which SEPs have this prior coverage requirement throughout the webinar. There are two notable exceptions to the prior coverage requirement. So people who are moving into the US from a foreign country or US territory in the past 60 days don't have to meet the prior coverage requirement. Or if the person is a member of a federally recognized Native American tribe or is an Alaska Native, they also don't have to meet that requirement. Next slide. Now let's dive into some common events that trigger a special enrollment period. Next, thank you. So as I mentioned, loss of other qualifying coverage is the qualifying event that a majority of people using an SEP will access. They might be losing eligibility for an employer plan, for example, if they lose their job, quit their job, or have their work hours reduced by their employer, and as a result aren't eligible for that benefit anymore. This includes people who are losing eligibility for Medicaid or CHIP. It includes cases when the insurer or plan sponsor cancels a person's plan. People might also be losing eligibility for a student health plan, or their COBRA coverage may be expiring. They could be losing pregnancy-related Medicaid coverage or medically needy Medicaid coverage, sometimes called share of cost Medicaid or Medicaid with a spend down. Or they may have a plan that's expiring at a different point in the year than the calendar year. Next slide. So let's look at how this can work in practice for someone losing other health insurance coverage. Here we have Roger and Candace. They're enrolled in a health insurance plan that Roger gets through his job. Roger quits his job in July and his insurance is scheduled to end on July 31st. He has the opportunity to get COBRA and continue his employer coverage, but it costs a lot of money. So Candace and Roger are eligible for the SEP for loss of other coverage, and they decide they're going to look into marketplace coverage. They learn that they have 60 days before and 60 days after Roger's employer coverage ends to pick a plan in the marketplace. They select a plan on July 16th, and the good news is that lets them seamlessly start coverage without any gaps starting August 1st. Next slide. So how would the scenario look if Roger's employer coverage ended in the middle of the month, say on August 15th? If Roger and Candace select a new plan before the first day of the month that their coverage ends, so in this case, that would be August 1st, their new plan will begin on the first day of the month in which they lose coverage. There will be a period of dual coverage, but this will not impact their ability to get financial help like the premium tax credit or cost sharing reductions. If instead, Roger and Candace select a new plan after August 1st, their new plan would begin on the first day of the month after they lose coverage, so September 1st. And because of this, they would have a 2-week gap in coverage. Next slide. So going back to the first example where coverage ends at the end of the month, let's see how that would look differently if they didn't pick coverage right away. In this scenario, you can see they don't pick a plan until the end of July. They're still within their SEP window, so they're still eligible for the SEP and they're able to get coverage, but unfortunately, they will have a gap in coverage. So again, this example is just to show that knowing about that advance availability is really helpful for folks that want to avoid a coverage gap, and planning ahead and selecting a marketplace plan before other coverage ends can be very useful. Next slide. Next, I wanted to talk about a new temporary SEP for people losing Medicaid or CHIP coverage during the unwinding of the Medicaid continuous coverage provision. This SEP will apply to anyone who loses Medicaid or CHIP between March 31st, 2023 and July 31st, 2024. So it is currently in effect. This SEP was created to help make it easier for people to transition to marketplace coverage now that states are beginning the process of resuming Medicaid and CHIP renewals and terminations. It can be accessed through the HealthCare.gov application by attesting to loss of Medicaid or CHIP. There's no need to contact the call center or provide documentation. And people can report loss of coverage up to 60 days in advance. And as you can see in the chart below, the earlier coverage effective date for people who lose other health coverage mid-month also applies to this SEP. Next slide. So let's go through an example. This is Neha. Neha receives a letter stating that she is no longer eligible for Medicaid because her income has gone up. Her Medicaid coverage ends July 31st. Because she will lose Medicaid coverage after March 2023 and before July 31st, 2024, she is eligible for the unwinding SEP. Neha acts quickly and enrolls in a marketplace plan on July 5th. So her marketplace coverage will begin on the first day of the following month, which is August 1st. Next slide. But what happens if Neha waits to enroll in a marketplace plan? Let's say Neha doesn't realize that her Medicaid coverage has ended until she tries to make a doctor's appointment in October and learns that she doesn't have insurance. Thankfully, she's still eligible for the loss of Medicaid or CHIP SEP, and she has until July 31st, 2024 to apply for coverage and choose a plan. But she wants her coverage to start as soon as possible. So she selects a plan on October 15th, and her coverage will begin November 1st. Next slide. This next SEP was new in 2022, but is still available in 2023. So there is an SEP available to people who have incomes no greater than 150% of the federal poverty line. And this is a really important way for folks who have low incomes and who are eligible for significant amounts of subsidies to enroll, even if in some cases they've been uninsured and they're just finding out about this coverage option. So an individual who's at 150% FPL has an income just under $22,000 for the year. They have to be otherwise eligible for premium tax credits. They do not have to have prior coverage. And this SEP does allow people to newly enroll in a QHP or for a current enrollee to change from one QHP to another one time per month. This particular SEP is only available in years when enhanced premium tax credits allow people with income up to 150% of the poverty line to buy the benchmark plan or the second lowest cost silver plan for a $0 premium. The enhanced PTCs became available under the American Rescue Plan Act that was passed by Congress in 2022. The Inflation Reduction Act extends these enhanced PTCs and therefore the low income SEP as well through the end of 2025. So key takeaway here, low income SEP is still in effect and will be through the end of 2025. Next slide. Looking at how this SEP works, here we have Jane. She's uninsured and lives in Texas. She earns $19,000 per year, so that is under the 150% FPL cutoff. And she recently found out she could access a plan at HealthCare.gov that would cost her $0 per month. So she goes to HealthCare.gov and starts an application. Next slide. It turns out she's eligible to buy a marketplace plan and is eligible for significant premium tax credits and for help with her deductibles and other cost sharing through cost sharing reductions. So if she enrolls in a silver plan, she'll get that help as well. Next slide. Next, we'll look at SEPs due to changes in household size. SEPs that fit under this category would be getting married and having a baby, adopting a child, or placing a child for foster care. With marriage, it's important to note that there is a prior coverage requirement. So one of the spouses, at least one of the spouses, has to have coverage in the past 60 days for at least one day, or they need to be living in a foreign country, so they're not really eligible for medical insurance coverage in the US, or be an American, Indian, or Alaska Native. In the case of birth, adoption, and foster care placement or court order, something important to keep in mind is that coverage begins retroactively to the date of the SEP event, unless the person calls the Marketplace call center to request that coverage start on the first day of the month following plan selection. Next slide. So let's look at an example of the adoption SEP and retroactive coverage. Lloyd and Samuel have Marketplace coverage. They adopt Mara on July 31st. They'll have 60 days to add Mara to their plan or select a new plan for her. They select a plan on August 20th, and so Mara's coverage will begin retroactively on July 31st, unless Lloyd and Samuel call the Marketplace to request that it start instead on the month, first of the month following plan selection, so September 1st. Next slide. Now we'll go over the SEP for moving permanently to a new place. If you're gaining access to new plans as a result of that move, it triggers an SEP, but this is another one where the prior coverage requirement applies. The types of moves that fit under this SEP include moving within the same city, county, or state, as long as there are different plans available. A person could move to another state, or you could have a child or other dependent that's moving back to a parent's home, or a student who's been attending school and either moves to school or back home from school. It includes people who are moving for seasonal employment but maintain another home elsewhere, and people moving to or from a shelter or other transitional housing. This SEP also includes folks moving to the US after living outside the country or in a US territory. So for those people moving within the country, they will have that prior coverage requirement. If they're moving from out of the country, that prior coverage requirement does not apply. Next slide. So this is Lori, Oliver, and Sonia. They live in Ohio and were all enrolled in coverage through Lori's job, but that coverage became too expensive, and so they voluntarily dropped it at the end of July. Because they voluntarily dropped their insurance coverage, they are not eligible for an SEP at that time. But then Lori gets a new job offer in Michigan, and the family decides to move there in early September. They're eligible for the SEP triggered by a permanent move because in this case, they did have coverage in the last 60 days. Next slide. Next, we have the SEPs that are available when someone is newly eligible or ineligible for financial help, and there are several SEPs that fall under this category. First, a person is eligible for an SEP if they move out of the Medicaid coverage gap. This could happen if they live in a state that has not expanded Medicaid and their income goes from under 100% of the federal poverty line to above 100% of the federal poverty line, resulting in them becoming newly eligible for the premium tax credit. Another way this could happen is if their household size changes or if they move to a new state and become newly eligible for the premium tax credit. A key distinction from the last example with the permanent move SEP is that a person moving out of the Medicaid coverage gap because of a move to a new state does not have that prior coverage requirement. And in any of these circumstances, the person does not have to have had prior contact with the Marketplace to be eligible. Next slide. Another type of change in eligibility for financial help occurs when a person's current employer plan is no longer considered qualifying coverage. This can happen if there is a change to the benefits or premiums of the employer-sponsored plan, and as a result, that plan is no longer considered to provide adequate or affordable coverage. It can happen if an employee's spouse or dependent is newly eligible for the premium tax credit because of the recent change in the affordability test for family coverage, also known as the family glitch fix. And if you'd like to learn more about that, there's a fact sheet linked at the top right of these slides. In these situations, if a person is dropping employer-sponsored insurance as a result of these changes, they will be able to get that earlier coverage effective date if their plan ends mid-month and they select a marketplace plan ahead of time. Next slide. People are also eligible for an SEP if they're found newly eligible or ineligible for premium tax credits due to a change in income or a change in household size, but only if they've already been enrolled in a QHP. There's also an SEP triggered for changes in cost sharing reduction eligibility that occur due to a change in income or household size. And this includes cases where people are moving between cost sharing reduction levels and if they're losing or gaining eligibility for cost sharing reductions entirely. And again, you need to already be enrolled in a QHP for this SEP to apply. Finally, there's an SEP available for people who are newly eligible for premium tax credits after decreased income. And this applies for people who have had at least 1 day of coverage in the past 60 days. Next slide. People are also eligible for an SEP if they gain eligibility for marketplace coverage because of a change in their immigration status or because they've been released for incarceration. An SEP is also available for people who are or become a member of a federally recognized Native American tribe or an Alaska Native Claims Settlement Act Corporation shareholder. Excuse me. This SEP also applies for a person who is or becomes a dependent of someone who is an American Indian or Alaska Native and is enrolled or is enrolling in the same marketplace plan as them. Next slide. So now we'll go over some of the less common events that can trigger an SEP. Next. So some of these include an enrollment or plan error, whether that is because someone was not enrolled in a plan, enrolled in the wrong plan, or did not receive a premium tax credit or cost sharing reductions that they were eligible for because of an error, misrepresentation, misconduct, or inaction by the marketplace, HHS, or other non-marketplace entity. This includes people who experience a plan or benefit display error related to plan benefits, service area, cost sharing, or premium that was displayed on a marketplace website and that influenced the decision to select or not select a plan. And finally, a person may be eligible for this SEP if a plan substantially violated a material provision of its contract. And something, a new policy to be aware of is that it is no longer just the enrollee or applicant who must provide documentation of these types of errors. Other interested parties may now provide documentation on their behalf. Next slide. Some other circumstances include being determined ineligible for Medicaid or CHIP. And note that this is different from the loss of minimum essential coverage or loss of Medicaid or CHIP coverage during the unwinding period. This SEP is for people who apply for Medicaid or CHIP during open enrollment or during an SEP, and their Medicaid agency determines that they or their dependent is not eligible for coverage. And this determination comes in after the enrollment period ended. So the SEP reopens the option for them to get coverage. This SEP is available regardless of whether the person applied through the marketplace or directly through the state Medicaid agency. There's also a SEP for people who have resolved a data matching issue or DMI after their coverage is terminated after the end of an initial inconsistency period. And this SEP applies to folks who have income under 100% of the federal poverty line and did not enroll in coverage while waiting for the marketplace to verify their eligibility based on their immigration status. Next slide. So this is an example of that SEP for resolving a data matching issue. Here we have the Torres family. Maria and Luis Torres are married and have 3 children. When applying for coverage, Luis gets a data matching issue and is asked to send in additional documentation to prove his citizenship. the marketplace determines that the documentation he sends is insufficient, and so his coverage is terminated at the end of July. In August, he sends in additional documentation, and his DMI is considered resolved on September 14th, triggering an SEP. The Torres family select a plan on October 16th, and so their coverage will begin the next of the following month, November 1st. Although they also have the option to contact the marketplace call center and request that coverage begin retroactive to that first date that coverage was terminated. Next slide. Some additional circumstances that trigger an SEP include being a survivor of domestic violence or spousal abandonment. And this also applies to dependents who can enroll in the same plan. Or gaining eligibility for a health reimbursement arrangement through someone's workplace. Again, this applies to dependents as well. Something to note here is that if the person is given notice 90 days before their HRA goes into effect, then they must enroll up to 60 days before the start date of the HRA. They're not able to enroll after the HRA goes into effect. Next slide. Finally, we have some exceptional or an SEP for exceptional circumstances. So if exceptional circumstances such as an unexpected hospitalization prevent enrollment and coverage during open enrollment, or if a person wins a marketplace appeal, they can access this SEP. And then finally, we have emergency and major disaster declarations by the Federal Emergency Management Agency, or FEMA. And this applies if an enrollee or their dependent resides in a FEMA declared disaster or emergency area, is qualified to enroll through an open or special enrollment period during the FEMA incident period. So they have to qualify for a different type of SEP, and then can show that they did not enroll due to impacts from that FEMA declared disaster. And again, here's just a reminder that the SEP flexibility for coverage lost during the COVID-19 national emergency will end June 9th, 2023. Next slide. Finally, I wanted to go over some things that do not trigger an SEP at HealthCare.gov. So voluntarily dropping other coverage will not trigger an SEP. Loss of eligibility for coverage when a person was not enrolled in it, like if they lose a job but weren't in their employer's health plan, would not qualify someone for an SEP. Being determined newly eligible for the premium tax credit if the person was previously uninsured, unless the person has income of no more than 150% FPL and they qualify for the low income SEP. Being terminated from other coverage for not paying premiums or fraud. Divorce or death of a family member if the person does not also lose coverage as a result, although there is an exchange option for state-based marketplaces to implement an SEP for divorce or death of a family member. And finally, becoming pregnant, although again, several states with state-based marketplaces have implemented SEPs for pregnancy, but that is not the case for HealthCare.gov states. Next slide. So again, here is an example of a situation that would not trigger an SEP. So here we have Eliza. Eliza's employer offers her coverage, but she decides not to enroll. She finds out in July that her employer is reducing her hours, so she no longer has the option to enroll in that coverage. Her income is going to drop as a result of these reduced hours, although not to 150% FPL. And she no longer has that offer of coverage. So typically she would qualify for a premium tax credit, except again, she didn't have coverage before. She's not losing coverage. And so she must wait until the next open enrollment period to enroll in a marketplace plan. So hopefully that's enough information to generate some great questions. And I'll pause now for Q&A.
Yeah, and we have a ton of really good questions. So in advance, I'm sorry, we're not going to be able to answer all of them. Again, you can email us at beyondthebasics@cbpp.org to have questions answered individually as well. But we're going to jump right into questions. This is sort of a clarification. You touched on this. Currently, HealthCare.gov asks a question regarding if a client has lost insurance at any point during the pandemic, and that will trigger an SEP. Now that the pandemic has sort of the state of emergency has been declared over, do we expect that question and SEP to end? And if so, when?
Yes, as I mentioned during the presentation, but it's definitely worth reiterating, that flexibility will end as of June 9th, 2023.
Perfect. And then switching gears, does the loss of Medicaid through the unwinding process mandate an employer special enrollment period? Many of our clients have had access their new employer insurance, and it may be, let me rephrase this question. So does the loss of Medicaid through unwinding mandate an employer SEP? We're hearing that some clients who took new employment but stayed on Medicaid are now being denied an employer SEP as their Medicaid unwinds.
Yes, that's a great question. So this is for employer-sponsored coverage, not for the marketplace. But under federal law, employers are required to provide a special enrollment period of 60 days after a person loses their Medicaid or CHIP coverage for that person to enroll in employer-sponsored coverage if they would otherwise be eligible for that coverage. Now, there is another kind of exception to keep in mind for this. If a person is losing Medicaid or CHIP before, I believe it's July 10th, 2023, that person will have up until September 8th, 2023 to enroll in their employer-sponsored coverage. So they have a bit more time if they lose Medicaid or CHIP during that period to enroll in employer-sponsored coverage. After that period, the mandated 60-day special enrollment period for loss of Medicaid or CHIP will apply.
Perfect. And then what if a family member had an offer of employer-sponsored coverage that was previously considered affordable and is now considered unaffordable due to the family glitch, the fix in the family glitch? They didn't enroll at the time, but do they get an SEP now that the coverage is considered unaffordable for them?
Great question. If the family member did not enroll in their employer-sponsored coverage, they will not be able to access an SEP, even if their employer coverage is unaffordable, if they choose voluntarily to not enroll in that coverage. However, if the family member did enroll in employer-sponsored coverage and they've realized they're newly eligible for the premium tax credit because of the family glitch fix, they can get an SEP. However, they should check with their employer to make sure that they can voluntarily drop their employer coverage mid-year, since that is up to the discretion of the employer.
Perfect. We'll do a couple more questions and then we'll move on, and we'll do more questions at the end. We had a few questions on the permanent move SEP and how much of a move triggers that one. So could you just clarify what type of move would trigger that permanent move SEP?
Sure. So the thing to keep in mind here is this SEP is triggered if a person has access to different marketplace plans as a result of their move. So again, it could be within the same county or state, but if the person has different plan options available, they would be eligible for that SEP. Something else to keep in mind is that if a person is moving, again, temporarily, like for medical treatment, that would not be considered a qualifying event for the purpose of this SEP.
Awesome. And then what if a family member stops being a dependent? Would that still be covered by the change in family size SEP?
You know, I'm not sure, but the like types of qualifying event that I know to be to trigger the SEP for a change in family size are just marriage, birth of a child, adoption, or foster care. I'm not sure if a person who isn't who's no longer a dependent would trigger an SEP.
And we can try and clarify on that and get back individually. So please email that question to us too, so we can get a clear answer. We're doing this on the fly. Okay, and then just one more question, and then we'll move on and answer more questions at the very end. So if a person loses Medicaid, has an offer of employer-sponsored insurance, but misses the 60-day period to enroll in employer coverage, what happens?
So in that case, the person can enroll in marketplace coverage, but they will not be eligible for the premium tax credit if their offer of employer-sponsored coverage is considered adequate and affordable.
Awesome, thank you. Okay, and now we're going to turn it over to Jenny. And again, we'll do more questions at the end. Thank you, everyone.
Great, thanks, Hallie, and thanks, Claire, for covering all of that. I know it is complex stuff. So thanks to folks. I suspect many of you have been to this webinar before, but appreciate the brush up from one year to the next, because it is complicated and there's always a few unexpected twists and turns. So I am now going to walk through the process for accessing SEPs, the verification process, and plan choice restrictions for certain SEPs. And then we'll have more time at the end, hopefully, for some more of your wonderful questions. All right, so now that you know more about the specific situations that trigger special enrollment periods and the timing and coverage effective dates, we'll talk now about how to actually access these SEPs. Now, depending on the SEP, a person can qualify when they are currently enrolled in a marketplace plan, as well as when they're not enrolled in a marketplace plan, keeping in mind, of course, the prior coverage requirements for certain SEPs. People who are currently enrolled should come back to the marketplace, log into their online account, and select the Report a Life Change option. They will need to advance through each screen in the application just as though they were applying for the first time, but changing only the information that has changed since the application was last submitted. People who aren't currently enrolled in a marketplace plan need to start a new application to access a special enrollment period. The application will then ask questions that will screen for SEP eligibility. At the end of the process, just like the regular application process, the person will get an eligibility determination notice. That's that PDF that the application generates, which will show any SEPs that people in the household qualify for and when they need to enroll or change plans by. If they need to submit any verification materials before they enroll or change plans, the notice will also explain what they need to do and the deadlines for submitting that information. A reminder, not all SEPs can be accessed through the application, and we will go over those in just a minute. So you can see on the right-hand side here is a little screenshot of what this looks like. It's the application, and we've gone to the Report a Life Change option. And again, not all changes are going to trigger a special enrollment period. That doesn't mean you shouldn't report them, but they won't always trigger the opportunity to switch plans. So for example, a person might have a new mailing address, but they live in the same service area where the same plans are available. So in that case, they don't get an SEP. Or somebody might have a change in income that triggers an adjustment in the amount of premium tax credit that they're eligible to receive, but it doesn't alter their overall eligibility for premium tax credits or cost sharing reductions. This is still a change that's well worth reporting so that people have limited repayment obligations when they file taxes the following year, and hopefully are better able to afford their coverage if their income has gone down, but they're not going to be able to change plans at that time. So it's important to encourage people to always update their application anytime there are changes in their household income, the people in their household, their address, their tax filing status, their marital status, or their immigration status or citizenship. So as I mentioned, most SEPs can be accessed through the online application, but there are a few, the ones listed here, that can't or that sometimes can't. These typically involve situations where a person needs to review the facts of a case to make a decision about whether the person's situation qualifies them for a special enrollment period. These SEPs have to be accessed through the call center or through a CMS caseworker. Either way, you start the process by calling the call center, and if the SEP requires a caseworker, then the call center representative can elevate it. We've hit on this a few times now, but because it's on the slide, I will just name it again one more time, that the FEMA SEP, due to the COVID national emergency, is ending and will not be available after June 9th of this year. Okay, so as with an initial application, some aspects of SEP eligibility do require a person to submit verification before the SEP can be granted and the person can enroll. And this is called pre-enrollment verification. Now, last year's annual marketplace rule that came out last spring changed the policy for states that use HealthCare.gov, removing the pre-enrollment verification requirement for all SEPs except for the loss of minimum essential coverage SEP. They recognized at the time something that we have long agreed upon and that I think most folks on this call will certainly be able to speak to from experience. Providing documents is an onerous administrative burden for people who are applying for coverage, and it disproportionately affects people of color and people who are younger. HealthCare.gov data from previous years showed that younger people and Black people were less likely to return documentation in response to a verification request, which means they aren't getting the assistance or the coverage that they're eligible to receive. So eliminating many of the SEPs for which pre-verification was a requirement, pre-enrollment verification, does reduce overall administrative burden. Keeping that in mind, the loss of a minimum essential coverage SEP does make up more than half of all the SEPs accessed through the FFM. So there's still a lot of people who will be affected by a verification request. CMS is able to leverage existing databases to attempt to verify eligibility before the person applying is asked to provide documentation. So in many cases, people who qualify for this SEP still won't be asked for additional documentation, and they'll be able to enroll right away after they're determined eligible. And I also want to note here that the unwinding SEP, as Claire mentioned earlier, does not have a verification requirement. So even if you're thinking that, oh, it's a loss of minimum essential coverage, we've lost coverage, and that's what's triggering an SEP, for people in that situation where their Medicare or CHIP has ended, they do not have to verify that loss of coverage in order to enroll in a QHP if they're otherwise eligible. So if a person qualifies for the loss of coverage SEP and they do need to provide documentation, they'll be able to select a plan, but their coverage won't begin until they complete the verification process and pay the first month's premium. People have 30 days after they select a plan to provide documentation. People can upload it to their account or mail their documentation in. Acceptable documentation includes a letter from an insurance company, a document from an employer, or a document from another healthcare program like TRICARE or Veterans Affairs. As with data matching issues, if the person has tried and is unable to locate appropriate documentation, keep in mind that they can submit a letter of explanation that includes what kind of coverage they had, the date it ended or will end, perhaps a little bit about why it's ending and why they can't submit the requested documents. And this can suffice for documentation of loss of coverage. We have a link at the bottom of this slide to a template available for this kind of letter at HealthCare.gov. Now, once the marketplace has successfully verified someone's eligibility for the SEP, they will send the person's information to the insurer, assuming the person has picked a plan, and then the person has to pay the first month's premium for their coverage to begin. Now, people don't have to choose a plan before they complete the verification process. They can wait until that process has ended and then go back to the marketplace, pick their plan, have the information sent to the issuer, and pay the first month's premium. But in order to ensure that coverage starts as soon as possible, it expedites the process if the person is able to make a decision about which plan they want to enroll in while they're waiting to get that verification paperwork completed. Okay, so sometimes it does take a little bit longer to resolve these issues, particularly if documents are being mailed. So if the verification process is delayed and the person isn't able to start using their coverage as of their original coverage effective date, then they can get retroactive coverage once the process has been completed. They can either pay their premiums back to their coverage effective date and have retro coverage back to that date, or if the verification issue takes more than 2 months after what would have been their original effective date, if it takes more than that much time to resolve, then the person can choose to have their coverage start a month later than the original effective date. If they, for example, don't have any healthcare expenses that month, then that saves them a month of premiums for care that wasn't received. So you might have noticed some similarities between the SEP verification resolution process and the data matching issue resolution process. These can get a little bit confusing, and people can actually have multiple verification issues going on at the same time. And so it's important to understand how these interplay. So first, we've got the SEP verification issues we've already been talking about. So when someone's completing an SVI or a SEP verification issue, they can pick a plan, but their coverage won't start till they resolve the issue and pay their first month's premium. They have 30 days to submit documents, and they are going to typically get some notices in between, maybe a 15-day warning call, reminding them to submit documents. And if they don't complete the process within that 30 days, then they won't be enrolled, and they can't enroll again until the next open enrollment period, or in case if they experience another event in their life that triggers a different SEP, for example. But there is one exception to this, which is if they're still within the 60-day window following the triggering event for their SEP, then they can apply for coverage again and trigger a new SEP verification window to submit the required documents. So moving to the middle column here, we've got data matching issues. And this is when a person is applying for coverage and something like their income or their immigration status can't be verified through existing sources. So in these cases, the person actually can enroll in coverage right away and use their coverage right away while they're in the process of resolving the issue. They also have a lot longer to resolve the data matching issue. They have 95 days for citizenship and immigration issues and 90 days for other data matching issues. And they're also going to get warning notices and phone calls throughout this period, reminding them to take action. But if the person doesn't resolve their DMI, they will either lose coverage, lose subsidy eligibility, or have their subsidy amount adjusted depending on the nature of the DMI. Now, if a person has both an SEP verification issue and a data matching issue, they have to resolve both of them. And their coverage could be pended until they resolve the SEP verification issue. Even though if they'd only had a data matching issue, they could have enrolled and started using their coverage before resolving the DMI. So this SEP verification issue trumps the DMI in terms of what you need to resolve in order to start having active coverage. Now, finally, on this last column, there's fewer interactions here, but just worth noting that identity proofing is also an issue. And this, of course, is the process that someone has to complete to set up an online account at HealthCare.gov. If a person isn't able to complete the process, then they can still enroll through the call center or a paper application, and they can manage their coverage through the call center. It's not an issue. But successfully completing the process gives them full access to the online application and plan selection tools available at HealthCare.gov. And if they have an SVI or a DMI, it also makes it easier to resolve those so that they can go online and upload their documents. Okay, we're coming up on the end here. Restrictions on plan choice for current enrollees. There are often restrictions as to what plan a current marketplace enrollee or family members of that enrollee can enroll in when somebody is eligible for an SEP. So for most SEPs, current marketplace enrollees are only allowed to change plans within the same metal tier as their current plan. So if you're enrolled in a bronze plan, you can only switch to another bronze plan. But if there aren't any other plans available in that same metal tier, then the person also has the option to enroll in a plan one tier higher or one tier lower than their current tier. So for example, somebody with a silver level plan could switch to a bronze or a gold plan if there were no other silver plans available. If a person qualifies for an SEP because they're newly eligible for cost sharing reductions or for a different tier of cost sharing reductions, they can change to a silver level plan because, of course, you need a silver level plan to access CSRs. If they're not already enrolled in one, then they can change to a silver level plan, or they can change plans within the same metal level as their current plan. For example, they're already in a silver level plan. Remember, there are 3 tiers, as you can see at the bottom here, of CSRs, and they're only available, again, if somebody is enrolled in a silver plan. Now, going in the other direction, if a person is enrolled in a silver plan and loses eligibility for CSRs due to an increase in their income as a percent of FPL, then they can choose a bronze or a gold level plan. Finally, current marketplace enrollees who qualify for the marriage or birth, adoption, or foster care placement SEP can only add the new family member to their current plan or enroll the new dependents or spouse separately in any plan. The family can't use this as an opportunity for everyone to change plans unless their current plan that they're enrolled in doesn't cover dependents. And in that case, the enrollee who already has coverage through the marketplace and the dependent that they're adding can enroll in a new plan together within the same metal level as the enrollee's current plan. And then, of course, the rule we talked about on the previous slide comes into play. If there are no other plans available in that category, they can switch to a plan 1 level up or 1 level down. Finally, some SEPs are exempt from these restrictions. People, if they qualify for these SEPs, can choose any plan available on the marketplace. We've got the SEP for American Indian or Alaska Natives, the SEP for errors or misrepresentation of plans, SEP for survivors of domestic abuse or spousal abandonment, the SEP for gaining eligibility for a health reimbursement arrangement through an employer, the SEP for exceptional circumstances, and the Emergency and Major Disaster Declarations SEP. Folks qualifying for these can change to any plan at any metal level. With that, I am done and we are ready to entertain some more of your questions. Hallie?
Great. So first question, if a person is denied Medicaid coverage by not supplying requested documents, would that be considered a qualifying event for an SEP?
Claire, do you want to take this or do you want me to?
Sorry, could you repeat the question?
Yes, of course. So if someone is denied Medicaid coverage because they didn't supply requested documentation, would they get an SEP in the marketplace, essentially?
Again, I'm not sure if there's a distinction between being denied due to being ineligible or being denied due to not providing adequate documentation, unfortunately, but I will look into that.
If they are procedurally denied from Medicaid, that does not qualify them for an SEP for marketplace coverage.
Awesome, thank you. And then let's see. You guys have a lot of wonderful questions. Do people who lose Medicaid due to this unwinding process have to provide documentation in order to get the unwinding SEP?
They do not. That SEP is accessed through responding to a question in the application or in the report a change series of questions as to whether the person has recently or will in the next 60 days lose Medicaid or CHIP. And if the person answers yes to this question, that will trigger the unwinding SEP.
Awesome. And then one moment, going back to that under 150% of the poverty line SEP, that sort of special one. Can you confirm that if someone has income below 150% of the federal poverty line, will they qualify for an SEP and not need any prior health coverage? So essentially, does that SEP, is there a prior coverage requirement for that under 150% of the poverty line SEP?
Here is not a prior coverage requirement.
Perfect. And then if a person is losing Medicaid and has an offer of health insurance through their employer, do they need to evaluate the affordability of the employer insurance to be eligible to enroll in the marketplace with premium tax credits for this SEP?
That feels like a question we drafted for you to ask us, but it wasn't. So thank you to whomever asked it. It's a really important point. Somebody is losing Medicaid or CHIP. If they're eligible for the marketplace and PTCs, great. We want to do everything we can to help them successfully make that transition. But eligibility for QHP and financial assistance through the marketplace is always contingent upon whether the person has an offer of affordable coverage from their employer. Now, we did have the change, the quote family glitch fix that Clara spoke about earlier, that changes the affordability test for dependents of a worker who has an offer of employer coverage. But for both folks, the employee and their family members, if the offer of coverage is affordable, then that's the coverage that they need to enroll in, or they can enroll in a marketplace plan for full cost, which is rarely the affordable choice. If the offer of coverage from the employer is unaffordable, then the person can go ahead and enroll in a QHP with financial assistance through the marketplace. The really important thing that we'll underscore, and we do every time we talk about the end of the continuous coverage requirement, is that if people do have an employer offer that's affordable, they need to make the transition from Medicaid or CHIP to that employer offer quickly. It's 60 days once we get out of that window that Claire spoke about earlier, where folks have until early September, I believe September 8th, to make the transition to employer coverage. After that date, people have 60 days after they lose Medicaid or CHIP to get into their employer plan. Otherwise, they may have to wait until their employer's annual open enrollment period to make the change. Employers can give more time than that, but they are not required to.
Perfect. And I think we will wrap it up with that. We have a whole webinar that is posted on our website and also in the chat that is all about this unwinding process. There's also an FAQ specifically around transitioning from Medicaid to employer-sponsored coverage. So those are in the chat, as well as our giant chart that outlines all of these SEP triggers and timing. That is also in the chat, and you can find it on our website. You can see sort of a preview of it right here. There's also a Community Catalyst SEP, sorry, thank you. A Community Catalyst SEP outreach materials. I will put that link in the chat and we'll send it around afterwards as well. All of these additional resources, I know you can't hit any of these links right now, but we'll send them all out after the webinar, so you'll have access to all of them. And again, we are recording this webinar and we'll post the recording as well as the slides and all of these resources to our website at healthreformbeyondthebasics.org. That will probably happen tomorrow. Our next webinar is, we're really excited. It's going to be entirely in Spanish, and it's going to cover key information on this unwinding process on the end of the Medicaid continuous coverage requirement and what enrollment assisters need to know to help people keep Medicaid if they remain eligible or transition to a different form of coverage if they are no longer eligible. We also have a special webinar on Medicaid appeals, Medicaid eligibility appeals, and that will be on Tuesday, May 16th. The Spanish language webinar will be next Thursday, May 11th, same time, 2 p.m. Eastern, 11 a.m. Pacific. You can register for either of those webinars on our Beyond the Basics website under upcoming webinars. And again, that website is where you can find all of our materials, references, past webinars, everything. Again, you guys had great questions today. A lot of them are really complicated too and not able to answer on the webinar. So you can always email us at beyondthebasics@cbpp.org if you still need an answer to that question. And then with that, I think we will bring this webinar to a close. Thank you so much again for everyone being here. We really appreciate it. And we hope to see you in the next couple weeks at our additional webinar. So thank you so much, everyone. See you soon.